Come in.
Hello, how are you?
Good.
I'm Sean, I'm your nursing assistant. May I see your ID bracelet?
Sure.
Alright, hi Miss Pat.
Hi.
I'm here today to empty your urinary bag. Would that be okay?
Yes.
Alright, well I'm going to go wash my hands and I'll be right back.
Alright.
Alright, at this point I'd wash my hands, and when I return, I'm going to place some gloves on. And anytime I place gloves on, I'm thinking about resident privacy. Miss Pat, may I close your door?
Okay.
Alright. Alright, I'm going to go ahead and gather my supplies, which is just 2 napkins and a urinary graduated container. And this container has cc's and ounces on it. Alright, I'm going to go ahead and set up my barrier down here on the floor. So what you do is you're going to put a napkin here so you don't ever touch the floor directly. And then I'm going to take my graduated container here and I'm going to put it down in front of the catheter. At this point I'm going to flip this up so you can see it. And you can unclip your catheter here. Now being careful, this bed is as high as it can go, so I'm going to be careful not to touch this container with this urinary catheter. Unclamp it and we can drain it fully. You can see I'm not touching the inside of the cylinder. I'm right in the middle. Okay. Alright. Now that all the urine is out, I'm going to reclamp this and place this back in its holder. And this is a urinary bag where the urinary drains. I'm just going to go ahead and pull this blanket back down. At this time, I'm going to stand up. And I'm going to place this back on my overbed table. Okay. Now once that settles, I'm going to give it a second. And the way you measure this is you got to get it eye level with it. And the right side is cc's and the left side is ounces. You're going to always document and read in cc's, okay? Alright, so this is right at 250 cc's. Now I have to remember that to document after I clean it, okay? So let's go ahead and go in and do that now. I'll be right back. Okay, now we're going to demonstrate how to properly clean a urine container. Okay, the first thing we're going to do is we're going to place a barrier down on our table. Now it's very important that if you need to read this, you can read it on a level surface like we demonstrated inside the resident's room. Next thing I'm going to do is go ahead and turn my water on and raise my bedside commode. This is no different than any other container. We're going to dispose of all the contents into the bedside commode. So let's go ahead and do that now. I'm going to go ahead and put a little water in there and swish it around, make sure I get all the urine out. Now these are large as well, so I'm going to use a napkin to help rinse the outside in. We're going to work from the cleanest portion to the dirtiest portion, which is the interior. Okay, and let's go ahead and rinse this one more time and pour that into the bedside commode very carefully, not to splash. Okay, let's go ahead and turn this off and shut this bedside commode. We don't want to forget that. Clean up our mess here. And I'm going to use a barrier to dispense some more napkins. I forgot to do that. Alright, now we're going to dry this from the outside in, or cleanest to dirtiest. Let's do that now. Okay, and now that I'm done, I'm going to return to the resident's room and place this container where I found it. And I'm going to change my gloves prior to documenting. Let's do that now. Now that I'm back, I'm going to come on back in here and place this back where it goes and put this away. I'm going to deglove now and change my gloves before I document. remember I had 250 cc, so I'm going to go ahead and document that now on this recording and documentation form. So I'm going to put 250 cc's and sign it. Okay. All right, Miss Pat, let me lower your bed to its fully lowest position. Would you like me to adjust the head of your bed?
Sure.
Okay. Well, tell me when it's comfortable.
That's good.
Okay, great. Well, your call bell's here. Everything's back where it should be, all neat and tidy. So I'm going to deglove now. Oh, may I open your door?
Sure, thank you.
Always good to do a post-procedure check for those reasons. So let's go do a post-procedure check again. All right, the bed's in its lowest position. I've adjusted the head of her bed. She has her call bell. The door's open. Everything's put up. So let's go ahead and deglove and go wash my hands using proper technique and come back and announce to the evaluator, end of skill.